record-breaking year for opioid deaths in Massachusetts. Here to explain is Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General Hospital. Thank you for joining us.
Thanks, Jessica.
All right, Dr. Raja, the Massachusetts DPH, the Department of Public Health, now says 2,357 people died just last year from an opioid-related overdose. It's more than any other year ever. So what can you tell us about the reasons?
It's a combination of things, Ben. So unfortunately, a lot of patients with opioid use disorder still can't get into treatment, which is a big part of it. But what's really unique over the past year is that the drug supply itself is actually tainted. So a lot of street drugs have fentanyl mixed in, and that's really powerful. In fact, 93% of the patients who died in the state last year who had tox screening tested positive for fentanyl.
Well, we know the state calls it a crisis. How is it impacting your emergency room?
Well, Jessica, here in Boston, we're still seeing about the same number of opioid deaths, which is really sad, but it's even worse out near Worcester or down near Plymouth. They saw about 15% more deaths last year, which is really devastating. Fortunately, though, the state is working on solutions. They're doing more training, they're allocating more resources, so I really hope that we'll see a better trend in the coming months.
As you know, there's a nasal spray out there now. It's called naloxone or Narcan that can block the effects of opioids such as heroin or fentanyl. Is it easy to get? Is it becoming easier to get? And how quickly does that kick in?
It is, Ben. It works really quickly. In fact, it can reverse an opioid overdose in a matter of minutes, and it's easy to get. So it's available in pharmacies, even without a prescription, and it's covered by Mass Health and a lot of other insurance companies. I myself, I carry a couple of nasal sprays with me, and I've had to use one outside of work, so it's definitely worth getting. You could really save somebody's life if you carry it.
Okay, important to hear. All right, Dr. Ali Raja, thank you as always for joining us and giving us your insight.
Thanks, Jessica and Ben.